how you got into the where. Tell me how that evolved to where you are with Vori Health.
Yeah, so the premise being low back pain is still the number one cause of global disability, even during post-pandemic. For years, lived with disability. World Health Organization, U.S. government will report those statistics. You'll find that to be the same in Canada, Europe, United States, Singapore, Australia. Everybody we have data on, and it's usually the top spend on most of the self-insured Fortune 500 employers and beyond. It's usually a top spend for most health plans. It's been published ad nauseum in the academic medical literature, Harvard Business Review in 2019, Vox, New York Times, Wall Street Journal. Average United States health system does 25 to 50% inappropriate, non-evidence-based back surgery every day, about 25% inappropriate knee replacements, and about 10 to 15% non-evidence-based hip replacements. We could spend a whole semester of how we got here since the war, but baked into Western society, the standard of care for musculoskeletal, particularly spine, is to not do the right care. This was recently audited by a variety of academic journals during the pandemic, and most people with back pain in the United States get the wrong care. It's not very sobering when you think about that. And this is done all from our top U.S. news system hospitals all the way down. Nobody's trying to be malicious. This has evolved over many, many decades. And what you see is a phenomenon of hospital systems really can't make a margin, meaning money, practicing medicine the way they've been structured since the 50s and 60s. And what I mean by that is during the pandemic, elective surgery, which is mostly spine, some cardiac procedures, was off or at a lower volume. You fill a hospital up full of medicine patients. Most of them were insured with COVID, ICUs. Hospital systems were building makeshift hospitals in the parking lot to take care of people in the pandemic, and were not able to make money. Actually, a lot of them took losses and had to beg the U.S. government for money. Mayo Clinic took a $900 million loss. Geisinger took a $300 million loss. This was a systemic problem. And most health systems, their bottom line is fed from either oncology, elective surgery, which is usually a lot of musculoskeletal orthopedics. And these business models have been set up by people's predecessors. So this is not to blame anybody. This is just the state of affairs. And so